With this peptide particularly, in Russia, it has been approved for generalized anxiety disorder. So we do see some benefits, which is very, very exciting to see a peptide that can make those kind of changes in the brain.
You're talking about persistent fear or worry. It can be sleeplessness, irritability. You're feeling tense. Those stress levels go up. The cortisol goes up. The effects on the brain long term of increased cortisol. But the drugs that we use for it are anti-anxiety and benzodiazepines, typically,
Exactly.
which, again, have side effects. Welcome to the channel and the podcast with me, your host, Dr. Debra Durst, and I have my co-host with me today.
Hey guys, Golombiewski, board certified nurse practitioner.
So, as you know, or if you're new to the podcast, maybe you don't, is that I am a traditionally trained physician that now specializes in regenerative medicine, and we have a practice, RevitalyzeMD. And Faraday and I work together every day with patients in the office, and our focus is regenerative medicine with a focus on sexual wellness too. Today we're going to talk about selank, which is a peptide, and that is a progressive area of medicine that's gaining in popularity.
And it's actually been around for quite a while. It was first founded in Russia back in the this one particularly in the 90s, and then has been used in clinical practice and human use since 2009. So it's really exciting when we see other countries doing this and using it and having good, solid studies.
Yes.
So that we can talk about these peptides, even though they're not approved here in the U.S., it allows us to talk a little bit more about clinical benefits because they're actually using it clinically.
Yeah, and so I think, again, peptides is one of those areas of medicine that you're never going to find huge studies because they are more naturally occurring, even though they're synthetic and made in a lab and sometimes aren't exact to a neurotransmitter or hormone in the body. They simulate a neurotransmitter or hormone, but are made up of amino acids. That's what a peptide is. So there's not a large amount of studies for peptides because of the closeness and structure to naturally occurring substances. But when you have studies, the things we're looking for in studies are safety and adverse effects. And again, they can be used in the U.S. even when not FDA approved. And FDA approved is something that is, again, taken through rigorous studies with a return on investment of the research supported groups, which are usually pharmaceutical companies, and they have to get a return. And if they can't patent that, then that limits a return in taking it to market with protection. And you're not going to invest, millions or billions in a drug getting it to market and can't protect it. Yeah, you can't protect or patent. So it doesn't necessarily, the lack of FDA approval specifically doesn't mean you can't use. It just comes from a compounded pharmacy, but also doesn't mean that it's not safe. But that's why we like to look at studies and sometimes in other countries so that we can actually see the safety and efficacy of these peptides. So again, selank, back to the selank, but that goes across the board with almost all the peptides except for just a couple with manufactured versions of them.
Absolutely. Right. And we use a lot of stuff in medicine off-label.
Correct. Yeah.
That does not have FDA approval. That's just a huge part of medicine and always has been.
Yeah. So you can have, and there's been more talk about that, especially with the Ozempic, craze, is that there is FDA approved indications and then there's off-label uses of FDA approved or manufactured, products. And so an off-label use is what you're doing with this, but this is also just a substance that wasn't FDA approved. So selank is the peptide. Peptides are amino acid sequences that, again, simulate neurotransmitters or hormones in the body. And this one is selank. And so I'll let Faraday go into, this is an exciting one that we probably started to look into maybe 9 months ago, because we hadn't used neuropeptides, and this is a neuropeptide.
Exactly. So with this peptide particularly, in Russia, it has been approved for generalized anxiety disorder. So we do see some benefits with that. It does cross the blood-brain barrier. It works on the central nervous system, and it does help with anxiety, which is very, very exciting to see a peptide that can change and make those kind of changes in the brain to see benefits in clinic.
Yeah. Well, and what we're going to talk about again is what is it? What can it be used for? What does
Yeah.
the study support, and what have we seen in practice? And so when we talk about it as a peptide, it's, again, it's a synthetic analog of what we call tufsin. And again, it's something like, again, from a medical standpoint, I probably do not recall learning about way back in immunology, but that actually has lots of effects on the immune system. And that was a 4 amino acid peptide. And then they added 3 more on one end of it that allowed for stability, but ability also to cross the blood-brain barrier. And it's mainly used as a nasal spray, which is an easy route to the brain. And so that is selank. And again, as Faraday talked about, anxiolytic properties are used for anxiety, which is great.
So it influences level of neurotransmitters such as serotonin, dopamine, and GABA to work on that anxiety side of it.
Yeah. And if we look at anxiety across the board, again, about 18% of the population in the US will experience one episode of anxiety in the next year, in a year. And about 30%, or right around there, actually in a lifetime, will have some kind of anxiety disorder. So when we're talking about, persistent fear or worry, it can be sleeplessness, irritability, you're feeling tense, those stress levels go up, the cortisol goes up, the effects on the brain long term of increased cortisol. But the drugs that we use for it are anti-anxiety and benzodiazepines, typically, which
Exactly.
again have side effects. So those are FDA approved, yes, effective, but also they have side effects and dependence issues.
That's it.
So
And benzodiazepine does work on enhancing GABA, right? To start that excitability within the central nervous system. So that is what this peptide does without the negative side effects.
correct, in the dependence
And without the dependence. So that's
Yes.
another huge one, is that benzodiazepines have a high addictive quality to them and do have a dependency with them where we do not see that with the peptides.
correct. And there's also withdrawal issues that you can have with the benzodiazepines. So when we're talking about benzodiazepines, which are BZDs essentially in
Or
short,
benzos.
yes, or benzos, Ativan, Valium, again, Restorol,
There's a long list of them.
Clonopine, like they're brand names and generic names, but you've heard those. And there's a lot of people on those. So if we can use a peptide, and the nice thing about this one, as Faraday mentioned, is that it does have that neuro effect, decreasing anxiety, but also there were no like safety concerns or adverse effects that were reported in all the studies that we looked at. And that is a good thing. Because again, the issue is those medications do have adverse effects.
They do.
They can make you drowsy, you can have dependence, and you can have withdrawal symptoms when you come off of them that include anxiety again.
Exactly.
And related symptoms.
in this one, in the studies, it showed efficacy within 2 weeks of use.
Yes, yeah.
So that's pretty quick. Oftentimes when we're getting into these medications for anxiety and or depression, it takes a long time for that medication to get into the body, come to a therapeutic level, and then you've got to be on them for a while to maintain, and that's where the dependency comes in and does play a role in that as well. So this was 2 weeks. That's
Yes,
what it was
yeah.
saying in the studies.
Well, in some of the studies, and again, anxiety is one of the issues. It can also have like a neuroprotective, anti-inflammatory. There's even immune, but some of those were even just one dose. They saw some improvement, just not very long lasting. So, and again, if we're looking at long lasting effects, there's not a lot of studies that showed chronic use over time, but there were some that also decreased the dependency on the benzos that were needed, and so decreased side effects of those and an increased efficacy when used in combination.
I did see that article. That's pretty interesting, using it as a combination.
Yeah, and there's some GABA, like even supplements you can use, and even those GABA medications, something that affects GABA can also be used with the selank with benefit. But so one of the studies was again 2008, and it was in Russia. So just so we know, this was discovered in Russia by the Russian Academy of Sciences or Medical Sciences. So it was, again, researching peptides, how you could make them more stable, what they could be used in. And so that was going way back into the early 2000s. But even it was like
19
1980 that they started to
Well,
research it.
they did. They started with another nootropic peptide first and then got into this one.
The CMAX,
Yeah.
which we're going
Which
to
we'll do another podcast
another
on.
podcast. So definitely make sure you look at that. So 2008 was one study that they did. So again, we're talking about 1980 CMAX, coming to market a little bit earlier than selunk, and both of them are neuropeptides that actually kind of have lots of similarities, but a couple significant differences too. But
Where this one particularly is more geared towards the anxiety, where the other's a little bit more of the neuroprotective, but they are very similar. So they have a lot of the same benefits and can be used together. So that's where some of these
Yes.
studies come into play.
Yeah, it's super exciting. When we started to read about it, again, it was within the last year. And usually our patients are prompting us to look at something. I will have somebody like bring it up, but this happened to be a patient that reached out to us that had a brain injury and was looking for neuroprotective agents to use for brain injury. And we don't have a lot of stuff here in the US.
We don't.
And so sometimes we are getting that data from other countries. So 2008, it was a small trial, 30 patients, generalized anxiety, and really was it was effective. And no side effects, and in fact, brain boosting effects with it. So there were some little things in this study that actually supported some brain enhancing effects of selunk. And then 2009 is when it came to market.
Yep, as approval for human use in Russia.
In Russia. And then 2015, again, was used. It was a slightly larger study, still nothing huge, 70, and it was used in combination with the benzo, and then was actually more efficacious than the benzo alone and less adverse effects. And so, but that was exciting. And
Yeah.
then you get to, and that's the main use of this one, and
That's
we'll talk to you about what we do in practice a lot with our patients now when we're using these neuropeptides.
And what we see with this peptide is that for route of admission or for use is going to be nasal spray. And that's what we do in our office as well, as a nasal spray.
So if you walk into a break room in our office or into an office like, Faraday's office, and she has the nasal spray out and is squirting something, I'm not too...
She's not concerned.
I'm not too shocked.
I just walked by. It's like there's no double takes anymore in our office.
Yes, no, you'll see all kinds
Between
of
the
things happening.
peptides
Yeah.
and, things can be, when we talk about peptides, a lot of them are subcutaneous injectables. This one is intranasal.
Yeah, which is actually quite a bit more easy to use, and patients do prefer that. There's brain protective, so it basically can have anti-inflammatory and immune modulating effects, because tufsin is actually an immune modulating peptide, and this is a derivative of that, so it can have anti-inflammatory and brain effects, protective effects. And so that is
talk
another...
about it in like pain and inflammation as well, but that wasn't as deeply studied.
Correct.
But I couldn't find any real studies on that, other than that because of the immune modulators from the
Yes.
tufsin, that it can help with that inflammatory and decrease pain.
So it talked more about it, and again, the similarities between CMAX and selunk are significant, and this is one of those areas. The anti-inflammatory effect was related to enkephalins, where it doesn't break them down, and those are molecules in the brain that help with pain and inflammation. And so it was really modulating the negative effects when those are broken down too fast. And they talk about that with CMAX too. So that's just an overlap between the two.
And that study, I believe, was that in rats?
That
'Cause I
one
don't
I
think
do
that one
believe
was
was
in
in
a
rats,
human.
because when it came to the non-anti-anxiety for selunk, usually it was related to rats. And so just studies, all human studies with the anti-anxiety neurotropic effects were without any significant adverse effects too. And these were even used with patients that are on medications, other medications, and with disorders that they're treating and still no adverse effects,
Yeah.
which is a good thing. And immune effects
The
too.
immune effects.
Even almost as antiviral and like one, but again, almost looking at rats and the modulation of increasing the anti-inflammatory neurotransmitters and decreasing the inflammatory markers. So again, I think this is an exciting area. Peptides are an exciting area of medicine and science, and I think it gets down to the root source of cellular function and amino acids and how they function in the body. So the science is so interesting when you start to read and we start to, if you see us a little more serious on this kind of stuff, because we are serious about peptides, and there's a lot of science, and our brains get a little,
excited sometimes.
Yes, yeah.
And then especially with this one, when we are able to look at use in clinical practice long term and still be able to say, hey, this has been in use with humans since 2009, but yet we're not seeing these negative side effects like we have with pharmaceuticals that we're traditionally using to treat the same type of diagnosis. So that is also really exciting to see on a clinical side, that there are other options outside of the traditional medications that do sometimes come with some pretty heavy side effects, where this is one that is just as effective, if not more effective in some cases, and are not carrying that dependence or not carrying that negative side effect profile.
Yeah, I mean, I think that is like key. And
It's
so when
huge.
it comes to practice, what we really want to do is have a practice that offers patients a progressive but science-based approach to something that doesn't involve medications, side effects, and even surgery. And patients are looking for that. They are looking for ways to treat or to optimize or to prevent in ways that don't include medication eventually, because our traditional model of medicine is we wait for disease to happen and then we put somebody on medicine with never a plan to take them off.
And it's
almost
usually
like
a Band-Aid.
Yeah, it's a Band-Aid, but it's also almost a lifetime commitment, because we aren't taught to take people off medicines.
And that's why it's a Band-Aid, because
Yeah.
we're waiting for you to be sick. We're not preventing prior to the illness.
Correct. And so that's where functional medicine regenerative is different. You're looking for what is the cause, how can we change it, how can we give the body back what it needs to improve something. And so while there isn't a lot of large studies with these, you almost have to accept that when it comes to bioidentical hormones that can't be patented or peptides. So you're looking for studies, science-based, but in patients that don't show adverse effects, and clearly you want some benefit, clinical benefit, and decreased adverse effects. And so for us, it's adding something that you can use that isn't a medication. And if you look at anxiety, it's pretty prevalent.
Mm-hmm.
The usual treatments are lifestyle changes: reduce your stress, stop smoking, don't drink, eat healthily, exercise, do yoga, do meditation,
Oh, yeah.
psycho behavioral therapy. But most people end up on some anti-anxieties for the most part, because I work the ER, I saw it all the time.
Yeah.
Again, it's almost a prescription exchange in relation to symptoms of some sort and control of symptoms, when in fact patients sometimes don't want to do that. They want to look for something that might be a little more natural but isn't going to be unsafe, and this is one of those. Selank's exciting, so that's where we come into play, to offer patients in a real life situation in an office based on science and what we deem to be safe and also legal.
I love how you
it's a
throw
key.
that in at the end.
Yeah.
And legal.
Yeah, because again, the online purchase of peptides is not through a physician. That is illegal. That is not something that I would recommend, that you are just online ordering yourself. You don't know what you're getting. This does happen to be a nasal spray, not an injectable.
But at the same
still,
time, it's still a medication that crosses the blood-brain barrier, or should I say, a peptide that crosses the blood-brain barrier that has an effect on the central nervous system. This isn't something you want to mess around with without understanding what you use it for, how to use it, and how to use it safely, and in what dosing to use it safely.
And the doses can be different. They can actually modulate the peptide a little bit to change some things. It seems like across the board, for the most part, that is safe, but you don't know what you're getting. It hasn't been tested. You want FDA-approved pharmacies that actually manufacture peptides, and you want a physician or provider that actually is also educated
Yes.
highly educated in peptides and the use of them with dosing. And we don't do dosing, so we get questions like that all the time. We would love to help in that way, but we don't know what you're getting. Could be a different concentration. It's impossible to dose
And
that.
we don't know if you need it.
And
So we don't
correct,
do
whether it's
dosing on our
even
podcasts.
indicated.
Yeah.
But I do feel like this is a very promising area, and you're right, Faraday. Like, again, medications that are FDA approved for this, like benzos, have been around for a long time. The safety profile is there. Again, even though they can cause some respiratory depression and issues, you have to be pretty high with a benzo to cause that. But
the
you have
abuse
side
potential
effects,
and the
abuse
dependency.
potential, yeah, and withdrawal symptoms
Yeah.
are significant with that. So this is an option and a potential exciting one. So
Have you used it? Do you have
Yeah.
experience with it? Let us know. Comment below. If there's something we didn't touch on that you read about or heard about, ask us.
yeah, if there's something that you have had it recommended for that isn't one of the indications that we talked about or one of the beneficial effects, we would love to hear more about it. So leave comments, share, like, subscribe, and if there's another neuropeptide instead you tried, then let us know about that too, because again, we're willing to deep dive into anything.
Anything.
Well, actually, really just anything.
Just anything.
Yeah.